A Metro woman beat breast cancer, but says the drug she took to fight it has had a lasting side effect that has her in tears.
It is a drug that's commonly prescribed, and it's now changed her looks permanently.
I never was a girly girl, you know. My hair was the thing that I always knew I could make me look more like a girl.
Connie Shatswell of Mustang knew when she went through breast cancer treatments back in 2010, chemotherapy would cause her thick brown hair to fall out. She just never imagined the hair loss would be permanent.
People look and have a sympathy look. I look like I have cancer.
Even though she's been a cancer survivor for almost 6 years. And no one could tell her why her hair never grew back. Until recently, she saw a post on social media that pointed to the chemotherapy drug Taxotere as a possible culprit. 5 years before she even took the drug, the maker Sanofi and Aventis did its own study and found Taxotere caused about 9% of its patients to lose hair permanently. And they warned patients in other countries, yet no warning was ever put on the drug in the U.S. until last year.
They didn't say a word. They didn't tell the doctors, and they didn't tell the women that used it. And these women had a right to know.
Oklahoma attorney Dan Markoff of Atkins and Markoff now represents more than 200 women who have similar complaints to Connie's. And he says what's important to realize here is patients could have used another drug without the permanent hair loss risk.
Tell them there are two drugs. They are the same. They work the same. One of them, you have a 9.2% chance of never growing your hair back, and the other, you have a 100% chance that your hair is going to go back.
We called the drug maker, Sanofi Aventis, and they appear to be blaming the FDA for how long it took to get a warning on the label. Here's what they had to say in part. As early as 2004, Sanofi submitted data about persistent alopecia or hair loss to the FDA as part of a proposed Taxotere label update. We encourage you to speak with the FDA regarding the timeline of the label update. So we did that as well. A spokeswoman with the FDA says it wasn't until 2015 patients started contacting the FDA complaining about permanent hair loss. And after some research, the FDA decided to change the warning label. As for what happened prior to 2015, the FDA is not commenting, only to say that labeling updates is an ongoing process. Connie's just hoping someone's held accountable for not letting her know of the lasting effects.
Anybody that has hair, they have bad hair days and they get so upset and everything. Can you imagine looking at yourself in the mirror and not seeing you, the you know?
Now, we did talk to a local oncologist who says as a doctor, she is more concerned with the bigger side effects like infections or heart-related issues. So for some people, Taxotere may still be the preferred treatment.